All right, everybody. Welcome to the Hormone Genius podcast with Teresa and I. We are very much looking forward to this dynamic duo. We are not just interviewing one woman today, we're interviewing two. And they call themselves Fertility Obsessed. So I love that so much. I'm going to have them introduce themselves about like how they met and how they got started with this partnership. But I'll do a quick intro so you guys all have a good sense of who you'll be hearing from. So Nora Jane Pope is a fertility care practitioner and is a retired naturopathic doctor and Creighton Model Fertility Care Practitioner, which is the FCP, with a private practice in Toronto. She is the creator of cycle charting and the Kiev Fertility CE seminars. Along with Dr. Jessica Lau, she is co-creating the 2021 Healthcare Professional Consulting Education webinar called Cycle Charting and Fertility Enhancement. Did I say your name?
You could say Lou.
Lou. Okay, so you guys
yeah.
know each other. So for those of you listening, if you want to watch us and if you want to see the little side glance where I mispronounced your name, go to YouTube.
It's all good.
Yeah, you can totally check that out. So Nora, she's published in several articles and journals, and she can talk a little bit more about that. And then Dr. Jessica Liu is also a naturopathic doctor with over 15 years of expertise and clinical excellence in the field of fertility, women's health, and pregnancy care. And she has a background in natural reproductive medicine and has helped hundreds of families conceive healthy babies, both naturally and with other things. So anyway, I'm going to have you guys give more information. How did you meet? Like, tell us about that kind of blossoming partnership.
We've known each other now for what?
Since 2005.
Right. That's right.
So 16 years.
Yeah.
We met at the Canadian College of Naturopathic Medicine at a continuing education course on women's health and doula care and perinatal care. Mm-hmm. And when I met Jessica Liu, I thought, boy, she's going places. And she was so positive.
I was a student then, I think.
That's right.
Finishing my clinical year.
That's right.
Yeah.
And I'd been in practice for a few years. I thought she's going places. So I thought she was very positive. And we just believe in a natural, reproductive health. And then I would run into Dr. Liu at conferences. I used to be on the board of the Association of Perinatal Naturopathic Doctors. Mm-hmm. So we produced a conference on women's health and natural obstetrics and midwifery. And she attended and she hugs me. I go, oh, okay. She's smart and she's nice. And then we went to a breast cancer conference and ran into her there. And I go, okay, she's nice, she's smart, and she's really smart because she kept answering all the questions that people had in the audience. And I thought, okay, so I like this person. And then I started teaching cycle charting to naturopathic doctors. Mm-hmm. And then she took my course in 2017.
And I'll interject, that was transformative for my practice. I was already treating many fertility patients, but her course and charting and, awareness just blew my mind. And I hit the ground running. I started the next day. And I think a year later, maybe you put out a poll on Facebook, how many people are using this fertility-based awareness method with their patients every day? And I was like, me. And no, it was quick, so this is something we're on a mission to empower other practitioners to teach their patients. So this is why last year,
it was during COVID and we were speaking on the phone. And she says, when is part two? I love your course. When is part two? I go, it's the marketing that kills me and the production. Anyway, so she said, I'll help you. And before you know it, we're 50-50 partners. And we revamped the course and from top to bottom. And we've sold, I think we've had 250 healthcare professionals around North America take our course. So some midwives, some medical doctors, some naturopathic doctors, pharmacists and nurse practitioners and dietitians.
Yeah.
And it's recorded. I'm very proud of it because we really go into a thorough integration of cycle charting and then timing the blood tests, timing the ultrasounds, timing the dosages for progesterone, timing the acupuncture, timing the herbs and the vitamins. So, and it's a good product. So we're happy. fertilityce.com.
Very
there we go.
Happy to be here.
Yeah, that's so awesome. I can imagine, Jessica, when you first went through that course, that it was mind blowing because of the fact that here you are doing all of this restorative natural health.
Yeah.
And you're like, oh my gosh,
Yeah.
I've been missing something about the woman's body. So, and I think
100%.
so many people are just like, how did I not like think about how important it is to understand the cycle and that we can actually do that so easily and then put that into practice. So I can just, I could feel like just how you would have been mind blown in that experience.
Also the fact that in naturopathic medical school, at least at that time, it wasn't talked about really. It was maybe glossed over very briefly, but I remember Nora sharing that at that time in the 90s in her class at CCNM, she was the only woman in her class who really knew her cycles, really knew about her cervical mucus. And it's just mind blowing that I think to this day, we're still getting students who are fresh out of school say, this is really in-depth information that I wish I had in school.
Yeah.
What? I don't understand. This is basic physiology of every woman that we should be empowering our children, our girls, right from the minute they have their first menses, and to see it in a positive light, to see it as empowerment. That's the goal, right?
Yeah.
Amen. Amen. And I want all of our listeners just to like stop and think for just a second. We're talking to people who know health. So of course we have our strong opinions, but we all, like Teresa, women's health nurse practitioner, Nora, Dr. Lou, she's a doctor of naturopathic medicine. Like this information is coming from people who scientifically understand the facts. And what's very interesting, and I would love for you guys to share a bit about how this works. Again, a good overview of the cycle in the red flow, the white flow, and that kind of thing. But just how interesting it is that this information is not easily accessible.
Yeah.
Isn't that interesting?
It really should be taught in schools from the get-go.
Yeah.
Yeah, absolutely.
Yeah, totally.
Yeah. No, I was asked by my high school, the Toronto French School, to talk to a biology class about human reproduction, because I had spoken at a career day about becoming a naturopathic doctor and then teaching fertility care to all my female patients, especially, and I got very interested in women with epilepsy, because in some women, low progesterone can bring on a seizure. So I think I want to show the multifaceted importance of progesterone for not just human reproduction, but neurological health and just mood and just general health in general. So anyway, the school was so impressed with my sort of worldview that they invited me to speak at a human reproduction or biology class. Anyway, the first class I had 12 girls and 1 boy. So I'm going on through the cycle and I'm going cervical mucus and everyone's crinkling their nose and the ick factor kicks in. And then sadly, a third of those girls who are teenagers were on the pill because of acne. So again, it was, mainstream medicine is very reductionist and quick and impatient, and they don't take the time to show that the menstrual cycle is a 5th vital sign, like Lisa Hendrickson-Jacks says in her book.
Yeah.
Anyway, so then the next class I taught was all boys. It was, 10 boys and 3 girls. So I come to the side with seminal fluid, and I just said, initially, the man's DNA, contribution to human reproduction it's located in the head of the sperm. And I'm looking at the boys, and I go, the man's contribution to DNA and human reproduction is his white flow. And it just came out. So anyway, and I go, and it's the importance of white flow is that it's alkaline, keeps sperm alive. It's full of sugar and fructose, lots of minerals, zinc, the man's mineral, and potassium. And that keeps sperm alive for up to 5 days. So I wanted the boys in the classroom to think about their white flow and the potential for new life and life staying alive in their bodies.
Yes.
And then I go on with the cycle charting and I say, and this is the woman's white flow. And white flow is throughout her body when estrogen is rising in the blood and turning on the cervical crypts and producing that white flow, which is, alkaline, rich in nutrients. So, so when a couple have intercourse during those days of fertility, the man's white flow stays alive in the woman's white flow in the fallopian tube for up to 5 days. And that's even though the egg is only alive for 12 to 24 hours, her fertility window is receptive with the white flow, and it's bathing the man's white flow. And then when we're conceived in the fallopian tube, we're bathed in white flow. So I want to shift away from the ick factor to water, ecology, being conceived in the fallopian tube, which is not common knowledge, I would say. It's not there in the mass culture. And then I get all Jungian, and I love Carl Jung. And so he talks about identity and individuation. So I say, when we're conceived in this tunnel, this dark, quiet place. There are no biomarkers for conception. It's very, very quiet. It's the most personal event in our new life. And then as we're transforming and cell dividing and tumbling down the tunnel, and we implant in the lining of the uterus, we create individuation, and a new life, can really, really thrive. But that new life begins in that fallopian tube. And so it becomes almost, I try to make it mystical and take away the ick factor. And anyway, so wide-eyed kids. And it was a wonderful experience. I'm so glad I spoke to the boys, and I had to ding, ding, and then, the white flow. And so then, because initially when I studied NAPRO, white flow was talked about for calculating due dates. But now I want to really expand the knowledge to white flow makes babies, which is our trademarked line. White flow makes babies. Yeah. So that's, I just love cycle charting. Anyway, sorry.
And and I do a lot of Chinese medicine, and white flow is a marker for health of the woman, right? Because if her white flow is healthy, it also means her estrogen levels are healthy. It means she's got spicy levels of libido and connection with her family. It means her cortisol levels are down and her stress levels are being well managed. It means she's taking time for self-care. Like, it's such I don't know if you've seen this, Teresa, in your practice, but when you've had a woman who's had a trauma or maybe a death in the family, or she's overworked and overtired and undersleeping, it directly impacts her white flow. I have a patient who is working through her fertility journey right now, and she's been 20 years she's lived with her cycle without a single ability to connect with white flow at all. Dry cycles, and she's a pilot. So upside down schedules, her nights are days, her days are nights. And when we started working together and she got her first bit of observation of white flow, it was like this crazy celebration, right? She didn't even think it was possible, but it just coincided with her feeling finally that she was actually connecting with her physiology, connecting with her body for the first time. And that was something we really celebrated.
Yeah. That's really interesting, because I just put out a fun, just fact today on our social media, and it was about stress and its impact on the endocrine system. Yeah. And what's unique about women's fertility is that you can actually measure almost stress by the change that occurs in the menstrual cycle. Whereas in some other respects, you can't always see the effect of stress and its kind of chronic poor impact on our health. So how cool is it that, just by alone watching the white flow and watching our cycle, that we can see and measure almost the impact of stress, which we know in some ways is the heart of so many kind of issues that we all have.
Right. Totally. And we also look at the quality of the red flow, right? If there's spotting ahead of time, if there's days and days of tail and brown bleeding, it tells us about the health of the lining and the health of the hormone levels the cycle before. So all of this information that you can put into a chart and reliably collect that data prospectively for a few months, it opens up this whole world of information for the woman without invasive blood tests, without her being obsessed with the numbers. It's just like teaching her how to connect intuitively with her own body's rhythms, right?
It's experiential. That's why we love the acronym SOFT, because I like to present it as learning about your cycle in 3D, like multisensorial way. So when I say, wiping, looking for the sensation, close your eyes. Close your eyes, because you want to sort of physically, with proprioception, figure out, if the wiping is draggy or is it slippery? Like, are you falling off your toilet seat slippery, or are you, and then observation, open your eyes. You're using your visual acuity.
Yeah.
And then finger tests, you're using your tactile senses.
Right.
And then you're looking for height and color. And so soft becomes a multi-dimensional tool to really experience your days of infertility as well as your days of fertility. And you gain that body literacy and that fertility literacy. And that it does take time. It's a bit longer, let's say 60 to 90 days, I think, to really get a sense of your body literacy as opposed to a quick prescription for the pill, so
absolutely. And I'll just say too, I love how you said observe in 3D. I love that. So for those of you who were listening and kind of working through that, so the acronym was SOFT. And so the S would stand for sensation, the O, observation, finger test, right?
Yeah.
And so I love that. But when you were talking about the 3D thing, it made me think of a friend of mine who was charting with me, and she had the hardest time trying to figure out the sensation, because that can be a tricky one when people are checking their mucus and they're trying to figure it out. So that's a very helpful tool, is if you're trying to figure out, like, is this mucus, the cervical fluid, this white flow, is it lubricative, which is a sign of very high estrogen? Closing your eyes instead, so that you don't get confused. But my friend, she was in a public restroom. She was telling me this story during a meeting, during an appointment. And she's like, okay, so I was in the bathroom and I closed my eyes and I wiped front to back and I said, yes, out loud. Like, I thought I said it in my head, but I said yes. Because she started, like, in the privacy of her own home, she'd ask herself in her head, am I lubricative? So if you start hearing women in the bathroom just saying yes, like answering a question, that's what she was doing. And I thought it was funny. So I love that 3D image thing. That's a great way to remember that.
Yeah.
And
just getting women comfortable touching that part of their bodies, right? It's just, we say it's sugar and water.
It's sugar and water.
It's something that is like a fifth vital sign, right? It's a sign of your health. We love Lisa Hendricks and Jack for that, coining that term. And it's super important because it's a biomarker for also other things down the road. When estrogen starts to decline, that's when your cardiovascular risk goes up. That's when your bone density declines, increased risk for mood disorder. Like, there's so much hinging on that physical representation of those hormone levels, right? So and it's an in the moment, real time observation.
And I think also, I want to jump in here. I think why I like cycle charting so much is that you don't fixate on the days of fertility. You don't fixate on the days of infertility. You're looking at a snapshot of a woman's life. And part of being a woman is having days of infertility and days of fertility. And in the pop culture, I mean, I am grateful. What's her name? Taking charge of your fertility. I think Tori Wechsler, good for her for putting it out there as a public health tool that we should learn about cycle charting. But what bothers me, I shouldn't say bothers me, but what I find limiting about her worldview is that, and of course, when you have rising estrogen, you're going to have rising libido. Yes, that's true. But in the NAPRO technology book, they did a study on female libido, and it was so interesting. You'd think there'd be more studies. This culture is obsessed with female libido. No, we don't want another pill like Viagra. Let's learn about it. And it's so interesting that for women, you could have libido any time of the cycle because we're human beings. We're not just cats and dogs making babies when the female's in heat. Sex is about spice. It's not just reproductive. It's about emotional bonding and couple bonding. And a woman could have high libido during her menses. Because some women, the plunge of hormones is a real relief. And she'll just feel very comfortable and confident, and she have very high libido. Some women, of course, will have high libido when the estrogen is rising, because you're more extrovert, you're more confident. And then some women have more libido on the dry days prior to the menses, because in some women, testosterone will rise a little bit. And so the point is that libido in women could be any time of the month. Good news, everyone. And it's not studied. I don't know why, but because you don't need a pill for that. Basically, it's women's health. And so I think with cycle charting, the challenge for us is to take away the fixation of only making a baby on those days of fertility and really open up spice and have, spice or sex any time of the month. And it's not just about making babies. It's about appreciating the days of infertility and fertility in equal value. So you don't have a reductionist approach to women's health. And that took me a while to click in, but it was, for me, you want low hormones during your period. You want low estrogen and progesterone on a dry day, pre-peak. You want rising estrogen during the white flow, and you want rising progesterone post-peak. And you don't want libido and fertility every day. You would die, So I think it's a very, in-depth, perspective on what it is to be a woman. So
yeah, I agree. And that assigning value more to those fertile days can be so stress provoking for some women. When women and men are in their 20s, it's all about preventing pregnancy. And then there's more pressure on the woman to do something about that, right? Versus fast forward 20 years, women in their 40s, now with the pressures on the man, right, to produce and perform. And now we're imposing fertility on the man. And so we don't want that. We want a woman to honor both sides of her cycle and know that there is value in the dry days as well, because that's going to help to clarify what those non-dry days really feel like, and to honor all of those days equally.
It's beautiful. I mean, you're bringing up just the complementarity of men and women and just the holistic view of the person, which oftentimes we just don't talk about. And we are different than animals. And so we really need to look at the spiritual and the emotional and the communicative and the intellectual parts of our body and our minds and put that all together. I love that. And it makes me think of a client couple that I had recently in their 20s, since you brought it up, Jessica, that in their 20s, you're kind of more concerned about avoiding. And this couple had just gotten married and they brought in their charting, and she was sitting there and she was feeling overwhelmed by the fact that she didn't know how to interpret confidently her days of fertility.
Right.
And we're talking about it, and I could just see the stress on her face. And she looked over to her young, good-looking husband and she said, "I'm so sorry about all this."
Aww.
And without even a hesitation, he says, "Why should you be sorry? I'm the one who's fertile every day."
Oh.
And I thought,
that's emotional.
Mind-blowing.
Emotional intelligence.
Instantly recognized that
Yeah.
he was the one that was the problem. And it sounds like his fertility is all the time. He's like, we just got to figure out your little window of fertility.
Right.
And how beautiful it was to see a young relationship like that. And again, just two people working together, and how if you chart the interest level of the relationship, it's completely different and dynamic. And
exactly.
I don't know, it's just amazing.
Yeah. It breeds connection, right? We often advise, it should be shared. So if a couple is charting, to not put all the onus on the woman, she has to be the one to observe, wiping observations all day long. Put the onus on your partner to chart with you and for you at the end of the day. Make it something he's equally invested in.
Awesome.
So we love that.
So we can use these natural systems to avoid pregnancy, to achieve pregnancy. And for those of you who haven't been listening to past episodes, definitely go back and listen to like ovulation, the main event, and an overview of the fertility cycle, so you can get a good, strong sense of the exact, tidbits on how to avoid, to achieve using these. But I also want to ask you, ladies, how do you also use that same chart data to understand issues with fertility or with women's health, and talk about your experience with that?
So I'll jump in with the rule of 5 here. So
it.
We want to simplify cycle charting as much as possible. So we came up with this term called the rule of 5. And a healthy cycle has those repetitive, healthy biomarkers month in, month out. So the cycle doesn't have to be identical number of days, because very few people have a 28-day cycle with ovulation on day 14, but you want the consistent biomarkers. So rule of 5, 5 days of red flow shows that the previous cycle had optimum levels of hormones. And then X number of days of dry days, it's variable from woman to woman, but then you want about 5 days of white flow, which shows that the follicle is growing. The dominant follicle is emerging from the ovary and in the cumulus oophrus, and then it's growing to anywhere up to 2.2 centimeters. And then after that, you want a stable post-peak phase of anywhere from 5 times 2 or 5 times 3 days, and 10 to 15 days, sort of cycle in, cycle out, with a variation of about 3 days. And so rule of 5. So if you can see that emerge after 3 or 4 months of charting, then you're really showing that you have healthy biomarkers in your cycle. So less than 5 days of red flow means you're probably low in hormones. Less than 5 days of white flow means you're probably low in estrogen. And less than 10 to 15 days post-peak phase, like if it's 7 or 8 days, or if it's longer than that, if it's 20 or 21 days, then if it's longer, it means ovulation probably didn't occur. Or if it's shorter than that, then you had maybe a preemptive ovulation or a premature rupture of the follicle, and your hormones are either too low or not high enough, not reaching that threshold. So, and then if you have more than 5 days of bleeding, you have the spotting. It could be an occult infection, like, necrotic tissue is building up because your hormones aren't high enough. The lining of the endometrium is not big enough. And so it kind of, breaks down prematurely and not thoroughly. Or, you could be low in progesterone the previous cycle. So rule of 5. And then, and how you treat that, there's all kinds of avenues you can take. So.
And we love to use the charting as a way to evaluate whether there might be a progesterone deficiency that would warrant proper testing. And this is the key, is that most of my patients are still coming to me saying, well, my doctor doesn't want to test progesterone, or he'll just test it on my cycle day 3, which absolutely makes no sense because that's not when we're looking for optimal levels. And really the ideal time is 7 days post peak mucus day. And we're still hearing people hammering home, it has to be cycle day 21. If you have a 24-day cycle, that doesn't make any sense. Progesterone's already declining. You're not going to get an accurate view to properly assess whether this patient is a candidate for progesterone therapy and ethical dosing of progesterone therapy. You don't want to give too much. You don't want to not give enough, right? So that's sort of where our course really hammers that in. That let's get away from the 28-day model. Let's listen to our patients and help them identify these biomarkers, and it alleviates the stress around, oh my God, I had a 35-day cycle. What do I do? My hormones are all off. Well, let's just go back to those biomarkers. Let's look at that white flow. Is it happening? Is it optimal? Then you're okay, right? There is variability. You're human. Life happens. So it just really helps to get them empowered and to get them to advocate for themselves with their healthcare practitioner, that there is variability in their bodies.
So a huge take-home point is that you cannot test hormones accurately unless you have a standardized and consistent way to identify the point of ovulation. And of course, you're hearing us talk about the white flow or the mucus, and the mucus, because every woman who is in normal fertility should have that, 5 days of mucus, hopefully. That is an easy and reproducible way to identify that point of ovulation. And so this is something all of us need to understand. And it's so important with getting accurate levels. And I know you guys also understand that the reference ranges that doctors use when we're looking at these hormones are not always accurate, because they don't understand, of course, that hormones change within the cycle. So another take-home point is that you have to have a practitioner or a physician who is able to know what the real reference ranges are in the cycle in terms of monitoring hormone levels, particularly progesterone and estrogen.
That's right. Yeah. Yeah. It's a really good point that you're making, because a lot of my patients who are going through fertility treatments of various kinds they're still not being tested for adequate levels of progesterone in first trimester. It's so important to know, are you being well supported to support proper implantation and placental development? And that is very progesterone dependent in the early days. And there's some studies that have come out now that shows that, in the UK, they said we could save 8,000 babies a year if they just tested progesterone and treated it properly. And those studies were a little bit,
the design wasn't ideal because they introduced progesterone too late and they removed it too soon.
That's right.
But the dramatic changes they did see in that, maybe limited design study was that the women with multiple miscarriages, we're talking more than 3, had the highest benefit because their body was starving for progesterone.
Right.
So the number actually could be 80,000 a year. And I don't want to exaggerate, but it could be a lot more than that, because had they tested for progesterone before conception, then they could have given preconception care as well as conception and then, pregnancy care. And as we all know, that there's a terrible assumption that the placenta is the only organ cranking out that progesterone throughout pregnancy. But, the poor little ovaries get overlooked, are the unsung heroes. The ovary without the corpus luteum is pumping out progesterone, as is, more importantly, the corpus luteum ovary, which can pump out 10 times more progesterone than the placenta. So, of course, you're going to need both ovaries to work during pregnancy. And so you want to monitor progesterone throughout pregnancy. And I think there could have been more women in the UK benefiting from this, but I applaud that country for attempting that study and publishing. And, they're really helping us be progesterone advocates for our patients. So more, please, more UK, more.
Yeah.
Yeah. What would you say, as again, our listeners are taking notes, what are some natural ways that women can address some of these hormone issues?
Yeah, that's a good question. I mean, there's so many things when we put on our naturopathic lens. It could be something as simple as constipation, right? Like not clearing hormones properly, getting too much exogenous hormones from exposure to plastics, or, if you put pesticide on your lawn, you don't know if you're imbibing that exogenous xenoestrogenic, these compounds that are basically displacing your own natural estrogen from clicking into that receptor site. It could be inflammation. There is a high correlation between people with a gluten intolerance and inability to conceive. There's so many things, and, just nutrition. If we just started with basic nutrition, like you can't go down the line of prescribing all kinds of herbs or supplements if you're ignoring the diet, right? So we know that the research is there, that a strongly sort of plant-focused, good protein, Mediterranean style diet, and there's new research that, in fact, a low pesticide residue diet with supplementation of B12 and folic acid in the methylated form, the 5-tetramethyl hydrofolate. I probably said that wrong, but you know what I mean? So this is the methylated bioavailable folic acid that the body needs and cannot really convert well in about 25 to 30% of the population. So these are some things that you want to be thinking about. Where can you get methylated folic acid in your diet? Dark leafy greens. What's the one thing that's missing in our North American processed food diet that's a diet of convenience is where's the green? So that's kind of where I start with most of my patients is, are you getting your greens, 2 big handfuls at, lunch and dinner at the very least, throw it into a smoothie, get it into a green soup. Nora and I have a green soup pretty much at every meeting that we have. And then things like vitamin D. It's such a simple, benign, safe, easy supplement. Low levels of vitamin D are correlated with a longer time to conception and increased risk of miscarriage. So really simple things to kind of optimize your health, keep inflammation down, and then we can start to build on regulating those hormones if the work is still there. But oftentimes, like, your hormones are going to respond to whatever you're doing for your health overall, right? So if you're working on your inflammation, if you're working on regulating your blood sugar, if you're working on getting good sleep and stress management and moving your body, oftentimes your hormones are going to follow suit, right? If they're off, there's probably something else going on in your lifestyle that's off too.
Yeah. I'm glad you mentioned sleep because we're suffering from light pollution all over North America. So if you can really have blackout curtains in your bedroom, remove all electronic gadgets because they have those blinking lights, that can help your body kick in melatonin naturally after about 90 minutes of darkness, which in turn will really complement progesterone function. Absolutely. And so just, basic lifestyle factors. And then you also mentioned blood sugar. There are other components that can disrupt hormones like blood sugar, which can give rise to unhealthy levels of testosterone, which in turn displaces estrogen function. So if your follicle isn't growing, it could be a blood sugar problem or a testosterone problem. And then in terms of progesterone, my big angle is allergies. Something as simple as hay fever can antagonize progesterone, as does asthma, high blood pressure, diabetes. And so by removing the obstacle to cure, you can let your progesterone thrive. And of course, progesterone HRT is very, very important, but you want to address the eczema, the psoriasis, the other allergenic or inflammatory conditions by treating the whole person. And in particular, in my practice, I saw a lot of women with psoriasis. By calming down the itchy, flaky rash, they not only conceived, but maintained a pregnancy. In addition to progesterone and other drugs like letrozole, for instance. But I think you needed the whole body approach to, really maintain that pregnancy. So that's how naturopath thinks. That's why. And then for acupuncture, Dr. Liu talks about acupuncture in the course. And our beef is even the Chinese textbooks say did 28 day cycles. So for day 14 acupuncture, we go, no. We call that, pre-peak and post-peak. And we call it peak minus this and peak plus this. For implantation, we focus on peak plus 10, so we tailor it to cycle charting. It's the woman's chart that drives the treatment plan.
Yeah, and the roadmap. Yeah. And then my big thing, sort of the mind-body stress connection, which is so huge. I'm sure Teresa and Jamie, you see this all the time. And I did some research on this, and it's crazy that up to 50% of people going through fertility challenges qualify for the criteria for a PTSD diagnosis, which is the same level of stress as going through something horrific or a cancer diagnosis. It's an incredible amount of chronic high-level stress. And what that would do indirectly to interfere with proper hormone functioning. And you can see that, of course, as you mentioned, Teresa, but, so I wouldn't ever give progesterone without the context of looking at stress hormone levels. What are we doing to nourish your adrenals? What are we doing to make sure you're protecting your sleep? What are we doing to make sure you're taking the time to eat regularly and, looking at a good whole food based, sensible, low inflammation diet? These are things that are so part of what we're doing as fertility practitioners, because we're not trying to fix the fertility. We're trying to restore the whole woman, right? Because if we're restoring that, then we're going to make sure that she's going to be healthy for her pregnancy, positive influence on her baby's genes and her baby's genes, which to me is like, it's like mind blowing, right? It's huge.
And you guys, you are showing just in that last, whatever that was, 5-6 minutes, how incredibly complex this all is and why it's so different than your traditional one pill solution for medicine. And it's often, I'm sure you go through this too, in speaking and educating your clients, that this is going to take a while. This isn't, this is reducing first inflammation. This is looking at nutrition. This is changing lifestyle, which is so hard for people. This is looking at your stress plate and saying, okay, I got to take some things off, which is really hard for women sometimes to do. Absolutely. There is a lot of pieces to the puzzle here. And you guys brought up a whole bunch of incredible tips there already, but it just goes to show you how restoring the human physiology is not easy. In some sense, it is in others, but it takes a lot of hard work and follow through. And that's why you need people like Nora Pope and Jessica Liu to be able to walk you through this. And why we need to train, more than anything, we need to train more healthcare providers, which I applaud you for your program, because we do not have healthcare providers that understand this and know how to do it. Yeah. I mean, all of these patients out there, they're like, please sign me up. Who do they go to?
I don't remember who said it, but it's like when you support a woman, you end up supporting a whole village. Yeah. Right. Like as a woman being that keystone and teaching her that hard work. For me, I want to reframe hard work is that you are investing in something that's worthwhile, right? Because when you put a little bit of investment into prevention and into your health, and you're learning about your physiology and how to keep it in a neutral zone, right? I have patients who they only see me once a year because they've learned all the lessons and they're following through and they know exactly what they need to do. And they come in and see me for a little tune-ups, but that's my joy. That's what I work towards, is I want to impart that education, that knowledge to my patients, that they can empower themselves and be their own advocates, right? And their own champions of their optimal physiology. So thank you for saying that, Teresa. I really, we believe in that wholeheartedly. Yeah.
Well, we're going to actually wrap up this interview with this last question. What do you wish every young woman knew about her hormone genius?
All right. So rule of 5, you want that 5 days of red flow, 5 days of white flow, and a stable post-peak phase of 5 to 15 days. And you can have libido any day of the month, ladies.
And that your hormones are beautiful. They're your roadmap to how do you live your life, how to hold healthy boundaries, how to learn where you need to protect your self-care a little bit more. So don't think of it as something to be fixed, but something that is informing your lifestyle choices that you have total control over.
Awesome.
Beautiful.
Very good. Ladies, share with our listeners how they can learn more about your course, especially those who are medical providers. But how can our listeners follow you?
Thank you. So our website is fertilityce.com. We offer continuing education programs for healthcare professionals. And the one we offer right now, which is about $197 is 6 hours. It's 2 hours of cycle charting and obstetrics, sort of obstetrics assessment, 2 hours of pharmacology. So we talk about how drugs can be repurposed to restore fertility in both men and women. And we cover about 15 different drugs. We spend a lot of time on progesterone, but it's very, very eclectic. And then 2 hours on traditional Chinese medicine and naturopathic therapies that include acupuncture, botanical medicine, diet and supplements, and botanical medicine. And
for a snippet, we have a free cycle charting masterclass that you can sign up for on our website at fertilityce.com, or ping us and chat with us on Instagram at fertility.ce. And we'd love to see you there. Thank you.
Awesome. Thank you so much, both of you. This has really been delightful to just learn from you, get to know you, and we've really enjoyed it.
Thank you for your work that you're doing. And it was a real pleasure to be here with you today.